Do you have thyroid issues? If so, this video is especially for you. As an endocrinologist, I see patients every day making common mistakes when it comes to managing their thyroid hormone medication. These errors might seem small, but they can significantly affect your health and treatment outcomes. In this video, I'm going to discuss 9 common mistakes people make when taking thyroid hormone and explain how to avoid them. You might be wondering, can I split my thyroid pills? Is it okay to switch brands? Are bioidentical hormones really better? What about interactions with other medications like weight loss pens or acid reducers? Should you take your medication before or after a blood test? And if you forget a dose, should you take 2 the next day or just skip it? I'll cover all of this and more so you can manage your thyroid medication the right way. Let's dive in and clear up the confusion once and for all. Mistake number 1, breaking the pill. Let's start with one of the most common mistakes I see, breaking the pill. Many people think that if they have a higher dose pill, they can simply split it to make the dose more manageable. For example, if you're prescribed 50 micrograms, but the pharmacy only has 100 microgram pills, you might think it's fine to cut it in half. However, breaking thyroid hormone pills is not recommended, and here's why. Thyroid pills are specially coated to withstand the stomach acid and are designed to be absorbed in the small intestine. If you break them, you risk losing some of the effectiveness because the coating may be compromised. The medication might not be absorbed properly, which can change how your body responds to the treatment. It's always better to ask for the right dose in pill form or take 2 smaller pills to achieve the prescribed dosage. This simple mistake of splitting your pills could impact your treatment and your hormone levels, so it's best to avoid doing it. Mistake number 2, forgetting to take a dose. What happens if you forget to take a dose? This is a question I get all the time. If you remember the same day, just wait an hour before eating and take the pill. Afterward, you'll want to wait at least 2 more hours before eating again. But what if you remember the next day? Here's the important thing. Don't double the dose. Just continue your regular treatment as usual. It's essential to note down that you missed a dose so your doctor knows if an adjustment is needed. Many patients think missing 1 dose here and there isn't a big deal. But over time, if you consistently miss doses, it can add up. For example, if you miss 3 doses in a 30-day period, you've missed 10% of your prescribed medication. That's significant and can affect your thyroid balance. So always keep track and inform your doctor. Mistake number 3, switching thyroid brands. Another common mistake I see is switching thyroid hormone brands. You might think that because all brands contain the same active ingredient, levothyroxine, it's fine to switch between them. But the truth is, it's not recommended to switch brands without consulting your doctor. And here's why. Even though the active ingredient is the same, different manufacturers may produce levothyroxine with slightly different bioavailability and bioequivalence. This means that the way your body absorbs and responds to the medication can vary slightly depending on the brand. Also, sometimes the raw material used to make levothyroxine differs between brands, which can affect your treatment. So it's always best to stick with the same brand unless your doctor approves a switch. This is especially important for thyroid hormone, as even small variations in the medication can impact your treatment and hormone levels. Mistake number 4, blood tests before or after medication. Next, let's discuss when to get your blood tests. Should you take your thyroid medication before or after the blood test? The answer is, get your blood test first, then take your medication. If you take your thyroid medication before your blood test, it can alter the results, particularly the free T4 hormone levels. TSH, thyroid-stimulating hormone, might not be as affected, but the free hormone fraction can be. This means that to get the most accurate results, you should have the blood test first and then take your thyroid medication afterward. No need to wait after the blood draw. Just take your pill right after and go about your day. Mistake number 5. Stomach medications and thyroid hormone. Now, let's talk about stomach medications like omeprazole and pantoprazole. These drugs affect stomach acid, so should you take them with your thyroid hormone? No, you should not take them together. Both thyroid hormone and stomach medications need to be taken on an empty stomach, but they should not be taken at the same time. First, take your thyroid hormone and wait for at least 30 minutes. Then you can take your stomach medication. This is because medications like omeprazole can affect how your body absorbs thyroid hormone. If you take them together, it could impact your thyroid medication's effectiveness. So, always remember, thyroid hormone first, then stomach meds after waiting 30 minutes. After that, you can eat. Mistake number 6. Weight loss medications and thyroid hormone. Another important point to address is the use of weight loss medications, such as GLP-1 analogs like Ozempic and Saxenda. These drugs can affect gastric motility, meaning they slow down how your stomach empties. This can interfere with how well your body absorbs thyroid hormone. If you're using weight loss or diabetes pens, it's recommended that you wait 60 minutes after taking them before taking your thyroid medication. If you're not using these medications, you can wait just 30 minutes. Medications that affect gastric emptying can slow down digestion and consequently hinder the absorption of thyroid hormone, making it less effective. Mistake number 7. Foods interfering with thyroid medication absorption. Many people are concerned about foods interfering with their thyroid medication. While there are plenty of myths out there, there are some foods that can actually affect thyroid hormone absorption. High-fiber foods like cereal, cottonseed, nuts, and soy flour can interfere with absorption if eaten immediately after taking your medication. You can still eat these foods, but it's best to wait about an hour after taking your thyroid medication before consuming them. This helps prevent any reduction in absorption that could affect your treatment. However, broccoli and cauliflower, despite what many believe, do not harm the thyroid. Studies on rats found issues with goiters when they were fed only cruciferous vegetables, but this does not apply to humans, so feel free to enjoy your broccoli and cauliflower without worry. These are just a few of the most common mistakes I see daily in my practice. By understanding these errors and making small adjustments, you can optimize your thyroid treatment and improve your overall health. Always consult with your doctor before making any changes and make sure you're taking your thyroid hormone as effectively as possible. In the next section, I'll address bioidentical hormones, how they compare to levothyroxine, and whether they're truly a better option. Stay tuned. Mistake number 8. Bioidentical hormones. Are they the better option? A question I get asked frequently is about bioidentical hormones. Many people believe that these hormones are the ideal solution for thyroid problems, but let's clear up the confusion. Bioidentical hormones are chemically identical to the hormones our body produces. For thyroid treatment, levothyroxine is considered a bioidentical hormone because it matches the natural hormone your body would produce. So if you're taking levothyroxine, you're already using a bioidentical hormone. However, some people are tempted to use other bioidentical hormone products that claim to be superior or more effective. These products may come from different sources, sometimes even animal-based hormones, and while they may be similar to human hormones, they often contain extra compounds like T3 that can cause more instability in your treatment. In fact, using T3 without proper medical supervision can increase the risk of heart arrhythmias and bone issues. This is why levothyroxine, T4, is still the first choice for most patients with thyroid issues. In rare cases, doctors may prescribe T3 for patients who cannot properly convert T4 to T3. However, it's important to note that T3 therapy is not standard for thyroid treatment and should only be considered in very specific medical circumstances. So, while bioidentical hormones may sound appealing, levothyroxine is already bioidentical and, for most people, remains the best option when managed properly. Mistake number 9. Thyroid hormone for weight loss. A common misconception I encounter is the use of thyroid hormone for weight loss. Many people believe that taking thyroid hormone will help them lose weight, but this is extremely harmful and should never be used for this purpose. If you do not have a thyroid condition, taking thyroid hormone to boost metabolism can lead to medication-induced hypothyroidism, which means your thyroid stops producing its own hormones because you are taking external sources. This can result in a slower metabolism, loss of muscle mass, and numerous health problems, including heart issues and high blood pressure. It's also important to note that TSH levels, the hormone doctors check when assessing thyroid health, are often misinterpreted. Some people believe that TSH should be below 2 for optimal health, but TSH levels of 3 or even higher are within the normal range for many individuals. There's no need to lower your TSH artificially if your levels are still within the healthy range. So, do not use thyroid hormone for weight loss. It's not safe and it could harm your long-term health. Thyroid hormone should only be used when there is a clear medical need based on a proper diagnosis. Final thoughts on mistakes. As we've discussed, thyroid medication is crucial for managing thyroid hormone levels, but even small mistakes in how you take it can have a significant impact on your health. Whether it's breaking pills, switching brands, forgetting doses, or using thyroid hormone for weight loss, these errors can affect your treatment goals and overall well-being. The key to effective thyroid hormone treatment is consistency, awareness, and proper guidance. Always take your medication as prescribed. Consult your doctor before making changes, and be mindful of how you interact with other medications and foods. Keeping track of your treatment and ensuring you're following the right steps is vital for optimizing your thyroid health. Remember, thyroid treatment is not one-size-fits-all, and it's essential to work closely with your healthcare provider to find the best approach for you. By making informed decisions, you can manage your thyroid health effectively and improve your quality of life. If you found this video helpful, please like and subscribe to stay updated on more tips for managing your thyroid health. Leave a comment below with any questions or experiences you'd like to share. And as always, make sure to share this video with others who may find it useful. Your health matters, and together we can ensure it's properly managed. Take care, and I'll see you in the next video.